Welcome to our channel. Today we are exploring potassium, an essential mineral crucial for overall health. It regulates fluid balance, nerve signals and muscle contractions, making it vital for heart health and blood pressure management. This video highlights potassium's role in cardiovascular well-being and the importance of maintaining optimal levels. Let's go. Potassium and heart health. Regulation of heartbeat. One of potassium's most crucial roles in the body is its involvement in regulating heartbeats. Potassium facilitates the transmission of electrical impulses that keep the heart beating at a steady and rhythmic pace. Without adequate potassium, the heart's electrical activity can become irregular, potentially leading to arrhythmias, a condition where the heartbeat becomes too fast, too slow, or erratic. By maintaining the heart's electrical stability, potassium prevents these dangerous heart irregularities. It acts as a balancing agent, ensuring that the heart's rhythm remains consistent, which is essential for the heart to pump blood efficiently throughout the body. Cardiovascular protection. Beyond regulating heartbeat, potassium has been shown to offer significant cardiovascular protection. A diet rich in potassium can help reduce the risk of developing heart disease. Studies suggest that people with higher potassium intake have lower blood pressure and, consequently, a reduced risk of heart attacks and heart failure. Potassium contributes to cardiovascular health by minimizing the strain on the heart caused by high blood pressure, one of the leading causes of heart disease. Reduction of stroke risk. Potassium's ability to maintain healthy arteries directly impacts stroke risk reduction. By keeping blood vessels relaxed and open, potassium helps improve blood flow and prevents blood clots, which are a leading cause of strokes. Research has shown that individuals with sufficient potassium levels in their diets are less likely to suffer from strokes, especially ischemic strokes caused by blood flow blockages. Potassium's role in blood pressure regulation, balancing sodium levels. One of potassium's primary mechanisms for regulating blood pressure is its ability to counterbalance the effects of sodium. Sodium, commonly found in processed and salty foods, causes the body to retain water, which increases blood volume and in turn raises blood pressure. Potassium, on the other hand, promotes the excretion of excess sodium through urine, helping to reduce blood pressure. This balancing act between potassium and sodium is essential for maintaining healthy blood pressure levels. Impact on blood vessel function. Potassium also plays a direct role in blood vessel health by promoting vasodilation, the relaxation and widening of blood vessels. This process allows for smoother blood flow, reducing resistance in the arteries and ultimately lowering blood pressure. By supporting proper blood vessel function, potassium ensures that blood flows freely, reducing the strain on the heart. Studies and evidence. Numerous studies have demonstrated a strong link between potassium intake and lower blood pressure. Clinical trials have shown that individuals with higher dietary potassium experience significant reductions in both systolic and diastolic blood pressure. The evidence strongly supports the idea that increasing potassium consumption, particularly through food sources, can be an effective strategy for preventing and managing hypertension. Recommended potassium intake for heart health. Daily recommended values. To support heart health, the daily recommended intake of potassium for adults is approximately 3,500 to 4,700 milligrams. This amount can vary depending on factors such as age, sex, and overall health. For individuals with hypertension or other cardiovascular concerns, ensuring an adequate intake of potassium becomes even more critical. Sources of potassium. The best way to increase potassium intake is through potassium-rich foods. Some of the top sources include bananas, potatoes, spinach, sweet potatoes, beans, and lentils, avocados, oranges. These foods are not only high in potassium but also provide a range of other nutrients that support heart health. Supplements. In some cases, potassium supplements may be recommended, especially for individuals who struggle to meet their potassium needs through diet alone. However, it's important to consult a healthcare provider before taking potassium supplements, as excessive potassium intake can lead to hyperkalemia, a condition that can cause dangerous heart rhythms. Signs of potassium deficiency and its impact on heart health. Symptoms of low potassium. A deficiency in potassium, known as hypokalemia, can lead to several symptoms that negatively affect heart health, including fatigue. Low potassium levels reduce cellular energy production, causing persistent tiredness and weakness. Muscle weakness. Potassium deficiency disrupts electrical signals needed for muscle contraction, leading to weakness and difficulty performing physical activities. Irregular heartbeat, arrhythmia. Potassium helps regulate heart rhythms. Deficiency can lead to irregular heartbeats or palpitations, muscle cramps and spasms. Lack of potassium causes involuntary muscle contractions, resulting in painful cramps and spasms. Digestive issues. Potassium regulates intestinal muscle contractions, and deficiency can cause constipation and slow digestion. Tingling or numbness. Low potassium disrupts nerve function, leading to tingling or numbness, often in the extremities. Difficulty breathing. Severe deficiency weakens respiratory muscles, causing shortness of breath. Mood changes. Potassium affects brain function, and low levels may lead to irritability, confusion, or depression. Thirst and frequent urination. The body compensates for low potassium by increasing urine output, causing dehydration and excessive thirst. Paralysis in severe cases. Extreme deficiency can result in muscle paralysis, especially in the limbs, requiring immediate medical attention. These symptoms can worsen over time, increasing the risk of more serious cardiovascular issues. Health risks of deficiency. A prolonged potassium deficiency can have severe consequences on heart health. Low potassium levels can lead to increased blood pressure, arrhythmias, and an elevated risk of heart disease and stroke. For individuals with existing heart conditions, maintaining proper potassium levels is essential to managing their condition and preventing complications. The balance between potassium and sodium. Importance of a proper ratio. In modern diets, the balance between potassium and sodium is often skewed, with sodium intake being too high and potassium intake too low. This imbalance contributes to elevated blood pressure and a greater risk of heart disease. To improve heart health, it's important to reduce sodium intake while increasing potassium intake, creating a more favorable potassium-sodium ratio. Impact on blood pressure. The potassium-sodium ratio is a critical factor in managing blood pressure. By increasing potassium and reducing sodium, individuals can significantly lower their blood pressure and improve overall cardiovascular health. This ratio is more impactful than focusing on either nutrient in isolation. Conclusion. Potassium deficiency can significantly impact your health, especially your muscles and heart. To maintain adequate potassium levels, consult a healthcare professional if you suspect a deficiency. Check out our recommended, tested, and budget-friendly food supplements to support your potassium intake. If you found this video helpful, please like, comment, share, and subscribe for more health tips.